So, welcome everyone. Today we're diving into week 4, covering chapter 13, the nervous system and psychological disorders. As future healthcare professionals, you want to make sure you master some of these terms because neurological and psychological terms appear across every medical specialty. Also, this is a longer chapter because it includes both nervous system and psychological disorders. So let's review core objectives. So we will first establish the physiological functions and selected anatomical structures of the nervous system. From there, we'll build out our vocabulary to understand pathology, diagnostic testing, surgical interventions, and therapeutic terms. Finally, we'll cover some psychological disorders, breaking down how mental health conditions are classified and described in clinical documentation. So we have to understand the anatomy. Think of the nervous system as the body's electrical grid. If you know how the grid is wired, understanding where a disease or procedure takes place becomes second nature. So the nervous system operates in a continuous three-step loop. Sensory receptors gather information from our environment or internal state. Processing and decision making, the brain and spinal cord act as the integration system, evaluating the sensory input, and then the brain sends an electrical command down to a muscle or gland to execute a reaction. In medical records, you'll often see sensory pathways referred to as afferent, moving toward the central system, and motor pathways referred to efferent, moving away. You'll see a little bit more of that here. So let's look at how the system is organized structurally and functionally. A structural split is the central nervous system is the command center, while the peripheral nervous system represents the communication wires running through the rest of the body. Functionally split under the peripheral nervous system, we have the somatic system, voluntary actions like moving your hand, and the autonomic system. These are involuntary actions like your heart beating. Autonomic branches, notice how the autonomic splits into sympathetic, fight or flight, and parasympathetic, rest and digest. Remembering these function divisions will help you understand drug classifications later, such as um, sympathetic medications and parasympathetic medications. To simplify your vocabulary tracking, group your roots into these two structural columns. When you see terms containing encephalo or myelo, you are dealing with the central nervous system, the brain, and the spinal cord. When you see terms built around neuro, you are generally looking at peripheral nervous system, the cranial and spinal nerves branching outward. So the cerebrum is divided into lobes, and their medical names tell you exactly where they sit on the skull. The frontal lobe is at the front. This is where the executive functioning is. The parietal lobe forms the top and sides. The occipital lobe is the very back, managing vision, and the temporal lobe sits near your temples, managing hearing. There's also a hidden layer called the insula deep, which is inside. If a surgeon performs a frontal lobotomy or a patient has an occipital stroke, you know exactly the precise map coordinate being discussed. So the spinal cord has 31 pairs of peripheral nerves branching off it. To memorize the count for each section, use the classic dietary schedule memory trick. Cervical, breakfast is at 8, thoracic, lunch is at 12, lumbar, a late afternoon snack at 5, sacral, dinner at 5, and coccygeal is a light midnight snack at 1 a.m. And this is just the brain game. You can link to this and it will test you on the different brain sections. So you can practice on your own with that. So when we look at auto, this means self. Autonomic is a perfect example, acting by itself, self governing. Cerebello refers specifically to the cerebellum, the little brain at the back responsible for balance. Cerebro or encephalo both mean brain. However, cerebro points strictly to the large cerebrum structure, whereas encephalo originates from Greek, meaning inside the head, referring to the brain as a whole. Cervical means neck. Be careful in the gynecology chapter. This refers to the cervix or the uterus, but in neurology, it always refers to the cervical spine neck. Coccygeal or cranio refer to the tailbone or skull. Dendro means tree. Think of dendrites branching off the tree. So duro means hard or tough. It refers to the dura mater, the tough outer layer of the meninges protecting the brain. Gillo means glue or sticky substance. So when you have neuroglia or the helper cells that literally glue and hold neurons together. Glioma is a tumor originating in these cells. Lumbo means lower back. Meningeo, the protective membranes. Meninges wrapping the CNS. Mento or psycho both point to the mind. Myelo is double meaning alert in orthopedics. Myelo means bone marrow. In neurology, it means the spinal cord. In nervo or neuro, both refer to nerve. So freno has a double meaning. It can mean the mind, like in schizophrenia, or the diaphragm muscle, like the phrenic nerve. Physio means nature or physical function. Spino or thoracic means spine. Ventricle means ventricle or belly cavity. Here's just a knowledge check. And now we're going to get into diseases and disorders. Cerebral vascular accident, or CVA, abbreviated, literally breaks down to an accident involving the cerebrum and its vessels. This is a clinical stroke and is an emergency. A transient ischemic attack, a TIA, transient meaning temporary, ischemic means holding back blood flow. So it's a temporary warning sign of a stroke and it needs attending to. Cerebral hemorrhage is cerebro brain plus hemo blood plus ridge is excessive bleeding. And this is a literal blood bursting forth into the brain. And that's also a medical emergency. Whenever you see the suffix itis, you want to think inflammation or infection. And let's look at how these used in meningitis is meninges plus itis, so it's an inflammation of the meninges. Encephalitis is encephalo, brain plus itis, inflammation, so it's an inflammation of the brain tissue. So then you have the combination of both of these where there is inflammation in both the meninges and in the brain tissue. And then you have neuritis, which is an inflammation of the nerve, and myelitis, which is an inflammation of the spinal cord, and finally shingles, which is caused by a herpes zoster tracking along the peripheral nerve path. The suffix kinesia means movement. Let's look at how this is used. With A, meaning without, and kinesia, it means the inability to initiate a voluntary movement. Brady, meaning slow, plus kinesia means extreme slowness of movement, and this is common in Parkinson's disease. Hyper, which is excessive or above, plus kinesia, is excessive involuntary chaotic muscle spasms or tics. So the suffix for paralysis is plesia. Let's pair it up with some numerical prefixes. Di, as in two, is symmetrical paralysis affecting corresponding parts, possibly both arms. Hemi means half. Hemiplegia splits the body vertically down the middle, paralysis of one side, and this is common in a stroke. Para is beside. Paraplegia is paralysis of the lower half of the body horizontally. And quadriplegia, is paralysis affecting all four limbs. Let's look at terms that look alike but mean completely different things. Phasia means speech, so aphasia is no speech, and dysphagia is difficult speech. Phasia means swallowing or eating. Look at the G versus the S. So think of GI tract. Phasia is the inability to swallow. Esthesia means feeling or sensation. Put the prefix "an" without in front of it, and you have anesthesia, literally a condition without feeling or sensation. So the cerebral concussion is derived from the Latin words meaning shake violently. It is a functional disruption without structural bleeding. Cerebral contusion is a literal bruise of the actual brain tissue involved in localized bleeding. And coma is a state of profound, prolonged unconsciousness where a patient cannot be aroused by external or painful stimuli. Let's look at pain and structural degradation suffixes. Algia means pain. So you add cephalo, head, and it is a headache. Neuralgia is a sharp nerve pain. If we add cephalus, you have hydrocephalus. Hydro, meaning water, is literal buildup of fluid in the ventricles of the brain. Malacia means softening. So, encephalomalacia is the pathological condition of the softening of brain tissue. When we have pathy, which means disease, encephalopathy is any disease of the brain, while neuropathy is a disease of the peripheral nerves. So, cerebral palsy, palsy means paralysis or weakness. So, it's a permanent motor disorder stemming from developmental brain damage. Myasthenia gravis, when we look at myo, muscle, asthenia, weakness, this is severe muscle weakness. Epilepsy is a chronic seizure disorder, and narcolepsy is narco, stupor or sleep, plus lepsy, seizure or attack, and it's a literal sleep attack. So here's just a knowledge check. Time for a brain break. So we're going to look at some psychological disorders now. So let's look at some combining forms. Arachno, spider. Claustro, a closed or shut in space. Pseudo is false. Zoo is animal, and agoro is marketplace or wide open public space. So asthenia is weakness. Esthesia is sensation or perception. Lexia is words or phrases. Orexia is appetite. So these conditions involve development and cognitive decline. ADD and ADHD are abbreviations for attention deficit disorder and attention deficit hyperactivity disorder. And these are characterized by inattention, hyperactivity, excessive motor movement, and impulsivity. Intellectual disabilities are limitations in adaptive and intellectual functioning. Dementia is an umbrella term for cognitive decline, literally a condition of losing one's mind, mental faculty. Alzheimer's disease is the specific progressive disease that is the most common cause of dementia. So, anxiety terms track nervous system overactivity. Post traumatic stress disorder, or the abbreviation PTSD, are conditions that involve flashbacks and extreme anxiety following a traumatic event. Pain attack is sudden, acute episodes of intense fear paired with intense physical cardiovascular symptoms. Obsessive compulsive disorder, which is abbreviated OCD, are obsessions that are intrusive thoughts. Compulsions are the repetitive driven actions used to quiet those thoughts. So these are several phobias. They attach specifically to the combining forms that we talked about. So fear of heights, fear of closed spaces, fear of spiders, fear of animals, and then there's even the fear of fear itself. So we have somatoform, dissociative, and personality symptoms. Somatoform breaks down into um, the somato, body, and then form. These are mental conditions that present as real physical body symptoms. Hypochondriosis is not known as illness, anxiety disorder, obsessive fear of having a disease. Pseudoplegia is a hysterical psychological paralysis where the limb won't move. And neurasthenia is nerve weakness, and it's a historical term for chronic mental exhaustion. So, mood disorders impact emotional regulation. Clinical depression is persistent state of sadness and loss of interest. Bipolar disorder involves mood swings between two poles, depressive lows and manic highs. Mania is an elevated high energy state. The mania suffix is when used as a suffix, it means uncontrollable obsession or compulsion. Megalomania is obsession with grandiosity or power. Pyromania is an obsession with setting fires. Kleptomania is an irresistible urge to steal things. So then we have eating and sexual disorders. Anorexia nervosa, if we include the "an" without in front of orexia, which is appetite, um, this implies an actual stopping of eating. So when you join that with nervosa, it implies a psychological condition of the origin of not eating. Bulimia nervosa is binge eating followed by purging behaviors. Paraphilia is para, abnormal or apart from, plus philia, affection and affinity for abnormal sexual attraction patterns. So here's a knowledge check. And now we're going to get on to diagnostics and interventions. So let's tear this massive word apart. Electro, encephalo. Electro is electricity, encephalo is brain, and graphy is the process of recording. So an EEG is the process of recording the electrical activity of the brain. The physical printout sheet or digital file itself is called an electrocephalogram. This used the exact same formula. So you have electricity, plus myo, muscle, plus graphy, a process of recording. An EMG records the electrical activity with a muscle to see if the muscle weakness is due to a nerve issue or a muscle issue. So, with our double root rule, Milo, since the test is performed by an orthopedist or neurosurgeons, they looked at spinal canal. Milo means spinal cord. Myelography is the process of recording an image of the spinal cord and nerve roots using a contrast dye injection. So cranio means cranium or skull. When you add that to tomy, it means to cut into. A craniotomy is cutting and temporary opening into the skull. A craniectomy means to excise or temporarily completely move. So a craniectomy removes a piece of the skull permanently or long term to let swollen brain expand. Cranioplasty means a surgical repair or reconstruction, and it's repairing the skull defect using a synthetic plate later on. So, some other surgical interventions on individual peripheral nerves are neuroplasty, the plastic reconstruction or surgical repair of a nerve cell pathway. Um, so, neurolysis means the destruction or separation or loosening. This is a surgical procedure to loosen a nerve from painful scar tissue adhesions. So, analgesics, if you break it down, it's an without algesic, which is pain, medications that make you without pain. These do not make you unconscious, however. They're split into non opiates, NSAIDs, and opiates, including morphine. Nerve blocks are intervention injections of a local anesthetic directly around where the pain is. Anticonvulsants combine anti against plus convulso seizure. While originally made to stop seizures, we use these as um, helpful to calm down or chronic misfiring nerve pain, like using Lyrica for fibromyalgia. Hypnotics are derived from hypno. This is the Greek word for sleep. These are medications designed strictly to induce sedation or sleep. Antidepressants combat clinical depression. Um, Antipsychotics manage hallucinations and delusions, and mood stabilizers treat the dramatic swings of bipolar disorder. Stimulants elevate neurotransmitters in specific brain regions to increase focus in an ADHD patient. So let's look at some non pharmacological psychological interventions. Cognitive behavioral therapy, abbreviated CBT, focuses on cognitions or thoughts and how they drive behaviors. Dialectical behavior therapy, DBT, is a subset of CBT and emphasizes emotional regulation and mindfulness. Psychodynamic therapy focuses on the dynamics or the unconscious mind, and exposure therapy intentionally exposes a patient to their phobia to trigger systematic desensitization. Here's a knowledge check. And we are done. Just remember to go through the terms. This was a really heavy chapter, and use your Google Notebook as well as your textbook reinforcement exercises.